Hey, what's up, guys? This is Dr. Nathu, and here with me is Dr. Mahdi, as usual, for the Dental Tips podcast. And how you doing, John?
Good. How are you?
I'm all right, not too bad. Um, so today I wanted to ask you about finishing and like
Mhm.
which burrs and what's your process for finishing restorations.
Mhm.
We'll start with like composites, and then I don't know if you do any amalgams or not, but we can go on to
Mhm.
amalgams.
For composites, I finish with a white stone.
Okay.
Um, yeah, a lot of people also like to use. Well, first the white stones can I use it a round and a pointy as well.
Okay.
So those are my main two finishing burrs. But a lot of people like to use a football burr, a diamond football, or a fluted carbide.
Okay.
So carbides, it's a little bit counterintuitive because you usually think of carbides as 330s
Right.
for cutting tooth structure and removing decay. Um, or 1557 is what we used in dental school. It's more cylindrical and has a flat bottom. And
Okay.
then there's a 1556, which has a bit of a cutting bottom. But you saw the other day I was using a 1772,
Yeah.
a little
Yeah.
bit thicker.
Right.
So you think of carbide burrs as these cavity preparation burrs, but after you've placed the filling, there's other types of carbides that come in a pointy fashion, and they come with different flutes. So
Okay.
the more flutes you have, the more finer the polishing is.
Right.
And I was at a John Nosti course, and he was saying how he uses that also for finishing restorations, polishing in the getting the occlusion and maybe some tertiary anatomy. So
Okay.
um, my father would use a sandpaper disc,
Right. The soft
and
flex.
yeah, he used the old school type that if you shofu is the best because if you there's no metal to it, so if you slip for whatever reason, you're not gonna put any kind of scratches in the tooth.
Right.
Shofu is one of the more popular brands. It's a good polishing disc,
Okay.
and if you're really trying to gloss up some anterior restorations, then after you've used your whitestone, your fluted burrs, um, and then you've used a shofu disc to set different grits of sandpaper. It's kind of like coarse, fine, extra fine. There's
Right.
four different
Yeah. I remember.
grits, and then a diamond paste. It's called on a Profi cup.
Okay.
It's basically like a toothpaste, but like a fine toothpaste, and I think it has some uh some synthetic diamond like particles in it, almost like an exfoliating lotion.
Right.
And then you use a Profi cup
Okay.
on a slow speed.
Yeah.
They have Profi cups that attach to slow speeds, and then that would really shine it up.
Yeah.
Uh,
Yeah. We use that. We use that in school. We don't use it
uh,
now. Like when I'm working, they don't have it. I heard it's really expensive. Like that tube with the little.
yeah, I mean one tube could last you a really long time. Uh,
Okay.
I I had one tube for years. I mean, I don't do a lot of anterior composites. I try to steer people towards ceramic veneers just
Yeah.
because they last longer.
And they're
Um,
more uniform too, right? Like the aesthetic.
yeah, I mean, doing it by hand, it's kind of nice in a way because the human aspect of it makes it more natural.
Okay.
Um, like so yeah, I think that is a nice quality about bonding composite
Right.
is that it's human. It's not perfect. Veneers are almost
Yeah.
too perfect sometimes.
It
I
looks
haven't
fake.
tried it yet, but I want to get into um, kind of playing around with the imperfection of a case, like a. But most people kind of want it perfect, especially when they're paying big money. So
Right. The perfect smile.
Yeah, I
like
mean,
Cristiano
yeah,
Ronaldo, like is that those
and
veneers.
yeah, exactly. All the Hollywood and Instagram look that everybody wants. Another good thing about composite for people that want a natural look is it's a little bit transparent, so it'll pick up some of the, shade variation that you have in the patient's natural tooth.
True, true.
Whereas ceramics just block all that out. So,
Right. So now for class, like for example, let's say you're doing class two, right? And like it's like all in the back, let's say like number 14 or whatever. And
mhm,
you're polishing it. And like I would go in with the white stone. And then the minute I get like functionality and
mhm,
like proper occlusion, good contact, like everything look the anatomy looks pretty good. I would just
mhm,
stop there and just like not use any fluted diamonds or like any
mhm.
fluted burrs. Like would do you ever do that or do you go through all the like you have a
Um,
system for it or do you just like
my 99% of the time, I just use a white stone
and then that's
to
it, right?
polish. Yeah.
Okay.
I'll use a K on a blue moon. I'll use like a round number 4 to get into a smaller groove because a patient has small tooth and the rounded white stones are kind of large. So
Okay.
yeah, you end up kind of just destroying their buccal or lingual cusp a little bit
Right.
on certain people, like people that have smaller teeth. So I
Mhm.
try to be more precise sometimes, and I'll use I'll use one of those, I think a football diamond occasionally, but yeah, 99% of the time. And actually, instead of using a small round carbide, I'll go to the pointy. If it's something I can't reach with the large circular white stone, I'll use a pointy white stone. That can usually get into a hard to reach place.
Right. Unfortunately, we only have pointy white stones. So like that's all I've been using and I use the diamond football like if I want to make the
Uh,
engineering on that. So like I'm working with just the pointy one. But I wish I actually want to I didn't know there were like, white stones that were like rounded, which that would be like really
yeah, there's rounded white stones and pointy white stones.
because they cut natural tooth structure a lot less like when you are polishing with the white stone. Is that's the idea behind it, right?
Yeah, I again, this Nasty lecture I was just at, he said that it can remove enamel, and I have maybe seen it. You'd have to kind of push pretty hard,
Hmm.
but it barely removes enamel. It's pretty dummy proof.
Okay, cool. Nice.
Yeah. Mhm.
And as far as your class twos, like you use the matrix band system, right? Like you don't use the Toffelmeyer.
I'll use a Toffemeyer, especially for an MOD,
Okay.
and then I'll use the sectional matrix for for the other side of it.
Okay. So like for like an MO or a DO, like you would use a
Uh,
matrix.
yeah, generally speaking, get better anatomy with the sectional matrix, but
Yeah.
the Toffemeyer is quick. Um, so if it's an MOD, I'll do the MOD with the Toffemeyer, and then if there's DO or MO right next to it,
Yeah.
then I'll use the sectional matrix system. Anywhere that I want a really good contact, I'll use a sectional matrix system.
Okay. And then
It's better to take your time and slow it down.
yeah.
Uh, like if it was just an MO on one
Hmm.
tooth, I wouldn't, or even an MOD on one tooth, I wouldn't use a Toffemeyer
Okay.
because it's not going to give you a good contact. I would
Yeah.
only use the Toffemeyer if I know that I'm going to have a chance to really establish a good contact, but because the adjacent tooth also needs a restoration. That's
Right.
really the only time I'll use a Toffemeyer.
Okay. Gotcha. Yeah, because
Yeah.
I noticed that like when because they don't have the whole matrix band system like at
Mhm.
work. So like what I've been using Toffelmeyer and I had to like tilt the like the band a little bit more to the tooth next to it to establish a better contact.
Yeah.
Yeah,
It's
like with the matrix band, you don't got to worry about that. Like it's just it's exactly how you want it because it has
mhm.
that contour on it. And did you if you when you do use the top more, do you put a wedge in there to like to get a better seal, or do you just like polish it up better, like nicely at the end?
Um, sorry, say that again.
So like when you do use the top wire, like do you put a
Mhm.
wedge in to make it like more
Yeah,
seal?
you always want to use a wedge. I can't think of a time where you wouldn't want to use a wedge.
Okay.
Yeah,
Okay.
because you're pushing the teeth apart, and
Yeah.
that way when you take the wedge out, and the teeth will kind of move back. So if you started with a good contact, you'll have an even better contact once you take the wedge out.
Got it.
That's the
Okay.
idea. And then also the seal too. It's really important for hemostasis and for to seal the
Yeah.
yep.
Okay, got it. Cool.
Yeah,
Yeah,
one
yeah. I've done a lot of fillings this week, and I was like just wondering because those things are very helpful, especially like because obviously the prep and stuff is not that it's not that difficult, but like
mhm,
the finish and the restoration for me personally, like I have more
yeah.
of a struggle like finishing and all that stuff. So
Yeah,
working on
prep
that.
can be difficult too, especially like on your upper left side or certain patients, just the way that their opening is or their teeth are tilted,
Yeah,
they have
yeah,
bad occlusion.
right.
Um, yeah, and then a good trick with wedges too is when you take them out and you move to the next tooth, sometimes you might want to just put it back in just to stop the bleeding because you'll notice when you take them out, the bleeding starts like where they may not have been bleeding before, but you just jammed this pointy object into their gums, and now when you remove it, all this blood starts gushing out.
Right. Okay.
Not gushing out, but you know,
Yeah, but like it
you'll
starts bleeding.
see. Yeah, and then if gravity is pulling it uh,
Right,
to another tooth that you just started filling,
right.
um, I mean, granted, that tooth should be sealed as
Mhm.
well if you put a good matrix on that tooth, but um yeah, there's like some little tips and tricks like that that you'll find
Okay, cool.
helpful.
Nice. All right,
Yeah.
thanks. I appreciate
Mhm.
it.
Yeah,
Anything
you
else
got it.
anything else about restorations that you think that would be helpful, like that you do?
Uh, can't think of anything at the moment, but I'm sure as we do some more talks, I'll something will come up.